So, let's dive into understanding preeclampsia, a serious health condition that can occur during pregnancy. Typically it develops after the 20th week of gestation, but sometimes, it can also pop up in the days or weeks after childbirth. This condition primarily involves high blood pressure and can affect many organs in the mother's body. Early recognition and management are key to protecting both the mother and her developing baby from severe complications. The main sign doctors look for to diagnose preeclampsia is new-onset hypertension. A blood pressure reading of 140/90 mmHg or higher on two separate occasions at least 4 hours apart usually indicates hypertension. Another key diagnostic marker is proteinuria, which means there's an abnormal amount of protein found in the mother's urine. Beyond high blood pressure and protein in the urine, preeclampsia can cause other serious problems. For instance, a woman might experience severe, persistent headaches, changes in vision, or pain in the upper abdomen. Preeclampsia is a global health concern, affecting approximately 2 to 8% of all pregnancies worldwide. Greater awareness can lead to earlier detection and better outcomes. Alright, let's unravel the causes. What triggers preeclampsia? The exact cause is still not fully understood by scientists. However, research strongly points towards problems with the placenta. The placenta provides oxygen and nutrients to the growing baby and removes waste products. In pregnancies affected by preeclampsia, it's thought that the placenta doesn't develop properly. Specifically, the blood vessels within the placenta may be abnormal. This can lead to a reduced blood supply to the baby, known as placental insufficiency. This placental dysfunction is believed to release certain substances into the mother's bloodstream. These substances can then cause damage to the lining of the mother's blood vessels, called the endothelium. This widespread endothelial damage is a key feature of preeclampsia. It causes the blood vessels to constrict, leading to high blood pressure and affecting blood flow to other organs. Another area of investigation involves the mother's immune system. Pregnancy is a unique immunological state, and some researchers believe that in preeclampsia, there might be a maladaptation of the maternal immune system. This could trigger an inflammatory response, contributing to endothelial damage and other systemic problems. Finally, there appears to be a genetic predisposition to developing preeclampsia. If a woman's mother or sister had preeclampsia, her own risk of developing it may be higher. Scientists are working to identify specific genes that might be involved. Understanding these genetic links could help in predicting who is most at risk. This knowledge could lead to targeted prevention strategies. So, who is more susceptible to preeclampsia? Several factors can increase a woman's likelihood of developing this condition. Chronic hypertension or high blood pressure before pregnancy is a significant risk factor. Obesity is another important modifiable risk factor for preeclampsia. Women who are significantly overweight or obese when they conceive have a higher chance of developing the condition. Conditions like pre-existing diabetes or kidney disease also elevate the risk. There are also non-modifiable risk factors which cannot be changed. Being pregnant for the first time is associated with a higher risk of preeclampsia. A woman's age can also play a role, with teenagers and women over 35 facing a higher likelihood. A personal history of preeclampsia in a previous pregnancy increases the risk of recurrence. A family history is also relevant. If her mother or sister experienced preeclampsia, her own risk increases. Pregnancies involving more than one baby, such as twins or triplets, carry a greater risk. Understanding these risks helps doctors identify women who need closer monitoring. Now, let's talk about managing preeclampsia and the current treatment approaches. The primary goals are to ensure the safety of the mother and to facilitate the delivery of a healthy baby. There is no cure for preeclampsia other than delivering the baby and the placenta. Treatment focuses on managing the symptoms and preventing serious complications until the baby is mature enough to be delivered safely. For women with high blood pressure, antihypertensive medications are often prescribed. A very important medication used in the management of severe preeclampsia is magnesium sulfate. Its main purpose is to prevent eclampsia, which is when preeclampsia progresses to cause seizures. If there is a high chance that the baby may need to be delivered prematurely, doctors will often recommend a course of corticosteroids. These steroids help to accelerate the development of the baby's lungs. Ultimately, the only definitive treatment for preeclampsia is the delivery of the baby and the placenta. The timing of this delivery is a critical decision. balancing the risks to the mother and the baby. Section 5. The crucial role of delivery in pre-eclampsia management. It is essential to understand why delivering the baby and the placenta is considered the definitive resolution for pre-eclampsia. The abnormal development or function of the placenta leads to the release of harmful substances into the mother's bloodstream. Once the placenta is removed, the source of these harmful substances is gone, allowing the mother's body to begin recovery. The decision about when to deliver is one of the most challenging aspects of managing pre-eclampsia. Doctors must weigh the severity of the mother's condition and the risks to her health if the pregnancy continues. Against this, they consider the baby's gestational age and the risks associated with premature birth. If pre-eclampsia develops near the end of pregnancy, delivery is usually recommended promptly. In cases of mild pre-eclampsia where the baby is still quite premature, doctors may opt for expectant management. This involves admitting the mother to the hospital for close observation. The mode of delivery, whether vaginal birth or cesarean section, depends on several factors. The obstetric team will discuss the best approach based on the individual circumstances of each case. Section 6. The shadow of recurrence. Understanding the risks in future pregnancies. For women who have experienced pre-eclampsia in one pregnancy, a common concern is whether it will happen again. Unfortunately, having had pre-eclampsia does increase the risk of developing it again. The overall chance of recurrence is estimated to be around 15 to 25%. Several factors can influence the likelihood of pre-eclampsia recurring. One of the most significant is the severity and timing of the pre-eclampsia in the previous pregnancy. If a woman had severe pre-eclampsia or if it developed very early in pregnancy, her risk of recurrence is considerably higher. Other underlying health conditions can also play a role in the risk of recurrence. Despite the increased risk, many women go on to have subsequent pregnancies without any recurrence of the condition. For those who are at higher risk, proactive measures and vigilant monitoring during the next pregnancy are paramount. Early consultation with an obstetrician can help to formulate a management plan. Section 7. Strategies for prevention. Proactive measures against pre-eclampsia. While it is not always possible to prevent pre-eclampsia entirely, there are several strategies that can help reduce the risk. One of the most well-established interventions is the use of low-dose aspirin. Typically, a daily dose of 75 to 150 milligrams of aspirin is recommended. Another preventative measure that has shown benefit in certain populations is calcium supplementation. Lifestyle modifications, especially those made before conception, can also play a significant role in prevention. Achieving and maintaining a healthy body weight is very important. A balanced diet and regular physical activity are beneficial for overall health during pregnancy. Above all, early and consistent antenatal care is fundamental for all pregnant women. Regular checkups allow healthcare providers to monitor blood pressure and check for protein in the urine. Section 8. The crucial role of early diagnosis and diligent monitoring. The importance of early diagnosis of pre-eclampsia cannot be overstated. When this condition is identified promptly, medical interventions can be implemented swiftly. This helps to manage the symptoms and prevent the progression to more severe forms of the disease. Regular antenatal appointments are the cornerstone of monitoring for pre-eclampsia. At each visit, a pregnant woman's blood pressure should be carefully measured and recorded. Her urine should also be tested for the presence of protein. If pre-eclampsia is suspected or diagnosed, the level of monitoring will increase significantly. This might involve more frequent visits to the clinic or hospital. It is also vital for pregnant women to be aware of the warning signs and symptoms of pre-eclampsia. This proactive approach and open communication can be truly life-saving. Section 9. Looking ahead. The future of pre-eclampsia research and enhanced care. Pre-eclampsia is a complex and serious hypertensive disorder of pregnancy. It poses significant risks to both maternal and infant health globally. However, with increased awareness, early and accurate diagnosis, and diligent management, the outcomes for women and their babies can be greatly improved. Despite the progress made, there is an ongoing and urgent need for more research into pre-eclampsia. Scientists are working to better understand the precise mechanisms that cause the condition to develop. This knowledge will pave the way for the development of more effective and targeted prevention strategies. One promising area of research is the search for better predictive tools. Researchers are investigating various biomarkers that might act as early warning signals. Advances in medical science and a growing global commitment to improving maternal health continue to drive improvements in care. The ultimate goal is to significantly reduce the global burden of pre-eclampsia, ensuring safer pregnancies and healthier starts in life for mothers and babies everywhere.